A Valley County fighting the Zika virus feels forgotten. The Cameron County Health Administrator says the state is providing more funding to other counties farther from the border. Channel 5's Daisy Martinez explains why health officials feel this is the case.
Two countries divided by a narrow river, weaved together by the constant crossing of folks from both sides. Cameron County Health Administrator Esmeralda Guajardo says it's that constant crossing that's making the fight against Zika very difficult.
I think this is probably one of those new emerging diseases that are out there that the state is realizing very quickly. We need to address this very differently from the rest of the state.
Guajardo believes the state doesn't realize how big of an effort and money it takes to combat the daily threat. Cameron County received $832,000 in state funds. Hidalgo County about half of that. The city of Houston and Harris County each received $1 million. Guajardo says Cameron County health workers are doing double the work with less cash.
They travel to Matamoros. And so we have to ask them, how long were you there? What were you doing? Were you know, some people go for medical care, or were they there for personal reasons to go out to a family function? Was it held outside? And do you recall being bit by a mosquito? And so our work does not stop. It's not that easy.
Nurse practitioner Yvette Guajardo is battling the Zika threat up close. She works with pregnant women who sometimes forget that they've traveled to high-risk Zika areas.
You know, the farther away you are from the border, then yeah, you're not going to have the patients that are migrating back and forth maybe once a week, going shopping in Matamoros or going to see grandma who's sick.
Ortega tells us she's also seen the number of pregnant women getting tested go down by about 30% in the past 2 months.
I don't think that it's because we don't have people who are at risk. I think we've just kind of noticed that people are maybe letting their guard down.
Guajardo says from January 2016 to now, there's been 28 positive Zika cases in Cameron County. 12 of those were pregnant women.
The impact is still microcephaly, and that's the issue that we're dealing with. People need to not make sure that they don't let their guard down.
Guajardo adds that as Zika evolves, the challenges will continue. She hopes Cameron County will stay in the mix when it comes to funding. From San Benito, Daisy Martinez, Channel 5 News at 6.
A part of the funds that Cameron County received will be used to set up a database to help keep track of pregnant women who test positive for Zika. This is a Channel 5 News Extra. Of that $832,000, $100,000 will pay for the database. A nurse will be hired and will be dedicated to keep track of the information. The database will keep localized information about women infected with Zika, will help provide support to women through their pregnancy, also help monitor children at birth. And a state registry also exists.